In a world where health and wellness take center stage, one topic remains shrouded in mystery: DHT levels in men. Did you know that daily habits can significantly influence these levels? Imagine a simple act, often brushed aside, holding the key to prostate health. It's true. As men navigate their daily lives, the effects of routine choices ripple through their bodies. What happens when this seemingly innocent habit becomes a daily ritual? How does it alter hormone levels, particularly dihydrotestosterone or DHT? This is more than just biology. It's about understanding how each choice impacts overall well-being. Picture this: a man, unaware of the silent changes occurring within, his prostate health slowly shifting, potentially leading to future complications. Could a few moments of pleasure today lead to larger issues tomorrow? Stay tuned as we unravel the connection between daily habits and hormone regulation. Discover how to take control of DHT levels while prioritizing prostate health. What can be done to ensure a balanced approach? The answers may surprise you. Keep watching to unlock the secrets of maintaining a healthy lifestyle that supports both pleasure and long-term well-being. Mechanisms of DHT regulation. Masturbation is a common practice among men, and it can have various effects on hormone levels, particularly dihydrotestosterone (DHT). DHT is a potent androgen that plays a significant role in male development and health. Daily masturbation can influence the body's hormonal balance, potentially leading to fluctuations in DHT levels. When a man masturbates, the body undergoes a series of hormonal changes, including the release of testosterone, which is then converted into DHT. Understanding these mechanisms can help men be more aware of how their habits may impact their hormone levels. In the context of daily masturbation, consistent activity could lead to a temporary increase in DHT due to the surge in testosterone. However, the long-term effects of this practice on DHT levels are not entirely clear. Some studies suggest that frequent ejaculation might stabilize DHT levels over time, while others indicate that it could lead to fluctuations. This complexity highlights the need for further research to determine the precise relationship between daily masturbation and DHT regulation. Moreover, the interplay between masturbation, testosterone, and DHT is influenced by various factors, including age, genetics, and overall health. As men age, hormone levels naturally fluctuate, and daily habits may have different impacts on younger and older individuals. As such, it's essential for men to consider their unique circumstances when evaluating how their sexual practices might affect their DHT levels. Ejaculation and DHT levels. Ejaculation frequency plays a crucial role in determining DHT levels. Research has shown that more frequent ejaculation can lead to temporary changes in hormone levels, including DHT. When a man ejaculates, the body experiences a release of hormones, and this process can create a cycle of hormonal regulation. Some studies suggest that regular ejaculation might help maintain healthier hormone levels over time, potentially reducing the risk of hormonal imbalances. On the flip side, infrequent ejaculation can result in a buildup of hormones, which might lead to higher DHT levels. Elevated DHT has been linked to several health concerns, including hair loss and prostate issues. Therefore, understanding the relationship between ejaculation frequency and DHT levels can provide valuable insights into maintaining hormonal health. Additionally, the timing of ejaculation may also play a role in DHT fluctuations. For example, ejaculating more frequently during certain periods might lead to different outcomes than doing so less often. This variability emphasizes the importance of personalizing sexual health practices based on individual hormonal responses. Impact on prostate health. Daily masturbation may have significant implications for prostate health. Studies have explored the connection between ejaculation frequency and conditions such as benign prostatic hyperplasia, BPH, and prostate cancer. Some research suggests that regular ejaculation can reduce the risk of developing BPH, a condition characterized by the enlargement of the prostate gland. This enlargement can lead to urinary difficulties and discomfort, making it essential for men to understand the potential benefits of regular sexual activity. Moreover, there is ongoing debate about the relationship between ejaculation and prostate cancer risk. Some studies indicate that men who ejaculate frequently may have a lower risk of prostate cancer, while others suggest that more research is needed to draw definitive conclusions. Understanding these dynamics can help men make informed decisions about their sexual health. The potential protective effects of regular ejaculation on prostate health underscore the importance of maintaining a healthy sexual lifestyle. While masturbation is often viewed as a private matter, its implications for overall health, particularly prostate health, should not be overlooked. Regular sexual activity may be a simple yet effective way to support prostate health as men age. In conclusion, the intricate relationships between masturbation, DHT levels, and prostate health highlight the importance of awareness and education. By understanding how these factors interact, men can take steps to promote their well-being and potentially reduce their risk of prostate-related issues. Effects on psychological and physical well-being. Masturbation can have a significant impact on both psychological and physical health. When discussing libido, it's essential to note how regular masturbation may lead to fluctuations in DHT levels. Dihydrotestosterone, or DHT, is a hormone that plays a vital role in male sexual health. Increased DHT levels can enhance libido, making sexual activity feel more appealing. However, excessive masturbation might lead to temporary decreases in libido, causing some men to feel less interested in sexual encounters. On the psychological side, the act of masturbation often brings about feelings of pleasure and relaxation. This release of tension can lead to improved mood and reduced anxiety. However, some individuals may experience guilt or shame after masturbating, particularly if they hold personal or cultural beliefs that view the act negatively. This conflicting emotional response can create a cycle of stress that may affect mental health and overall well-being. Moreover, the relationship between masturbation and self-esteem is notable. For some men, regular sexual release can enhance confidence and body image, while for others, feelings of shame can diminish self-worth. Understanding this connection is crucial for men seeking to maintain a healthy relationship with their sexuality. Balancing the physical benefits of masturbation with a positive psychological outlook can lead to a healthier self-image. Physical effects also come into play with regular masturbation. Engaging in this act can stimulate blood circulation and promote prostate health. However, it's important to consider moderation. Excessive masturbation might lead to physical discomfort or even conditions like pelvic pain. Therefore, being mindful of one's body and its signals is essential for maintaining physical health. In summary, the interplay between masturbation, DHT levels, and psychological effects creates a complex relationship. While it can enhance libido and provide emotional relief, it's also vital to recognize the potential downsides, such as feelings of guilt or physical discomfort. Striking a balance is key to ensuring a healthy approach to masturbation. Tips for healthy control of DHT levels. Maintaining healthy DHT levels is essential for overall well-being. One effective strategy is adopting a balanced diet rich in nutrients. Foods high in zinc, such as nuts, seeds, and lean meats, can support hormone regulation. Additionally, incorporating healthy fats, like those found in avocados and olive oil, can contribute to hormonal balance. This nutritional approach helps ensure that the body has the necessary tools to manage DHT levels effectively. Another important aspect is regular exercise. Physical activity not only promotes general health but also plays a role in hormone regulation. Engaging in strength training and cardiovascular workouts can help maintain optimal DHT levels. Exercise is known to enhance mood and reduce stress, which can further support hormonal balance. Finding a workout routine that one enjoys can make it easier to stay consistent. Stress management techniques are also crucial for controlling DHT levels. High stress levels can lead to hormonal imbalances, including elevated DHT. Mindfulness practices, such as meditation and yoga, can be beneficial in reducing stress. These activities help individuals connect with their bodies and emotions, promoting a sense of calm and balance. Moreover, staying hydrated is often overlooked but is vital for overall health. Drinking enough water helps maintain bodily functions, including hormone production. Proper hydration ensures that the body operates efficiently and can help regulate DHT levels. Setting reminders to drink water throughout the day can be an effective way to stay on track. Lastly, consulting with a healthcare professional can provide personalized guidance. Regular checkups and discussions about hormonal health can help identify any issues early on. A healthcare provider can offer tailored advice on diet, exercise, and lifestyle changes to support healthy DHT levels, ensuring that individuals feel their best both physically and mentally. Recent studies and research Recent studies have increasingly focused on understanding the relationship between masturbation and levels of dihydrotestosterone (DHT, as well as its effects on prostate health. Researchers have been investigating how regular sexual activity, including masturbation, influences testosterone and its derivatives. Some studies suggest that frequent ejaculation may play a role in maintaining balanced hormone levels, potentially influencing DHT levels in the body. One significant area of research looks into how these hormonal fluctuations can impact overall health, particularly regarding the prostate. Some findings indicate that regular ejaculation might lower the risk of prostate-related conditions, although the exact mechanisms remain unclear. Researchers are working to establish a clearer link between ejaculation frequency and the regulation of DHT through various hormonal pathways. Moreover, recent evidence has highlighted that individual responses to masturbation can vary widely. Factors such as age, genetics, and overall health can influence how one's body responds to sexual activity. This variability makes it essential to approach findings with caution, understanding that not everyone will experience the same hormonal changes. Additionally, ongoing studies are evaluating the psychological aspects of masturbation and its role in sexual health. Researchers are exploring how the psychological benefits of sexual release may also correlate with physical health outcomes, including hormone regulation. This intersection of mental and physical health adds another layer to the conversation about masturbation and DHT. As more research emerges, it becomes clear that there is still much to learn. The complexities surrounding hormone regulation and sexual health will likely continue to be a topic of interest in scientific communities. Understanding these dynamics can help inform healthier practices related to sexual activity. Myths and facts about masturbation and DHT. A lot of myths circulate regarding masturbation and its effects on DHT levels and overall health. One common belief is that frequent masturbation significantly raises DHT levels, leading to various health issues. However, scientific evidence does not support this idea. In fact, many studies indicate that normal sexual activity, including masturbation, does not have a long-term negative impact on DHT levels. Another myth is that abstaining from masturbation can lead to a dramatic increase in testosterone and DHT levels. While hormonal fluctuations can occur, they are often temporary and do not necessarily lead to sustained changes in hormone levels. Understanding that these hormonal processes are complex and influenced by multiple factors is crucial for dispelling such myths. Additionally, some people believe that masturbation can result in prostate problems or increase the risk of developing prostate cancer. However, current research suggests that regular ejaculation, whether through masturbation or sexual intercourse, may actually lower the risk of prostate issues. This counterintuitive finding challenges the negative perceptions surrounding masturbation. Moreover, many myths imply that excessive masturbation can lead to physical and mental health decline. While it is important to practice moderation, the act itself is a normal part of human sexuality and does not inherently cause harm when practiced responsibly. Recognizing the difference between healthy sexual expression and compulsive behavior is key to understanding its effects. Finally, educating oneself about the facts versus the myths surrounding masturbation and DHT can lead to a healthier perspective on sexual health. As more accurate information becomes available, it helps to foster a more informed and open dialogue about these important topics. As we wrap up today's exploration of DHT levels and the effects of daily masturbation, it's essential to remember that knowledge is power. Understanding how ejaculation impacts your body can help you make informed choices about your sexual health. Are you surprised by what you've learned about DHT and its connection to prostate health? Think about it. Regular ejaculation might play a role in preventing issues like benign prostatic hyperplasia. That's a big deal. So, what steps can you take to maintain healthy DHT levels? It's not just about frequency, it's also about balance and overall well-being. Before you go, consider this. Have you noticed any changes in your body or mood related to your habits? Reflecting on these questions can lead to greater awareness and healthier choices. And remember, we're all in this together. If you have personal experiences or tips that have worked for you, share them in the comments below. Your insights could help someone else on their journey. Keep the conversation going, and don't forget to subscribe for more engaging content on sexual health. Until next time, stay informed and take care of yourself.